Hello everyone. This is Dr. Oza from Thurmont Smiles. Today I want to share 7 tips with you about how you can handle dental emergency at your home if you cannot reach your dentist during the weekend or if there are any circumstances where you cannot reach your dentist. Unfortunately, very frequently, I receive phone calls and emails from our patients who experience dental emergencies. So, I'm going to share some things with you that you should keep at home just in case if something happens, so you are well prepared. Before we dive into it, I want to thank you, all of you, because today we received 100 Google reviews. It is a huge thing for me. I've been in Thurmont for 9 years now, and I'm so thankful for our wonderful patients. We appreciate your support, and I'm definitely going to celebrate this big win with our team members and with all of you. We are thinking of doing some kind of giveaway for sure. So keep an eye out for that. And let's dive into today's topic. So dental emergencies, I usually see two main kinds of dental emergencies. One is either something is sharp, so either the tooth is broken, like it's fractured, or a crown has come off, but something is sharp in the mouth and food is getting stuck, that kind of emergency. And second most common that I'm sure most people are aware about is toothache or severe pain. So let's talk about the tooth fracture. So I'm going to pull up this picture here. So you can see right in the center, the person has lost the crown from the tooth, and it is the edges are pretty sharp. As you can imagine, this would really bother the lip and the tongue. If it is in the back side of the mouth, I've seen very sore tongue and ulcers in patient's mouth. So what you can do, there are two things that you can do there, or you should keep. The first thing is, let me show you here. So this is a temporary cement that CVS usually carries, and you can see there is a spatula here. You just either fill the crown and then put the crown back onto the tooth, or you can fill a part that has broken off until you can see your dentist. It is really important to try to clean that area and not seal in the food or any particles that you may have inside the tooth, and dry the tooth as much as possible, and then you can fill that area. There is another thing. I actually pulled this from my cabinet. This is ortho wax, as we call it. If you have young children, then you probably know the orthodontists usually give this wax. I know Amazon sells that, and this is what it looks like. And what you do is just you break off this little part here, and then you roll it up, and you can press it on your tooth, bite into it, and that should seal that area temporarily if it's bothering your tongue or cheek, or if it's open and it's giving you some kind of sensitivity or pain. Again, these are not long-term solutions, but these will really help you. Now let's talk about severe toothache. So the toothache usually happens because there's some kind of swelling inside the hard tooth structure. So the swelling is not always a big swelling of the face. It could be inside the hard roots of the tooth, and because it cannot grow, because it cannot expand, it causes a lot of pressure onto the tooth nerve, and that's where the pain comes from. So there are two things you can do to reduce the swelling, and I have this medicine here. So this is Advil Dual Action. This is an FDA approved drug. Now take it only if it is something that you are able to take. So it has both ibuprofen and Tylenol combined, and that is usually what I tell the patients to take until I can see what's going on. So this is a very powerful painkiller. So that will definitely reduce the inflammation some, and then it will also help you with pain. The second thing you can do in case of severe pain is cold. So I don't know where I got this from. It says MetLife, but it is a cold compress. You can see it has some beads, and I just took it out of my fridge. So I always keep something like this in my fridge. Also frozen peas, anything, or ice if you can tolerate that, and you can put it on your cheek for 20 minutes on and 20 minutes off, and that also relieves the pain. I have pulled a few other things you can keep at home. My room is smelling like garlic here, but garlic can reduce the pain, believe it or not. And you can just kind of squish this and just hold it on that tooth, and that will relieve the pain. If the pressure is too much, you can just cut a sliver and then hold it in place, and that will definitely help you. Um, we pretty much all of us have the vanilla extract in our fridges, and what you can do is just soak a cotton ball and then hold that onto that tooth, and that also helps relieve the pain. The other thing I have here is the essential oil. So this is, I definitely 100% recommend that, and it has to be a good quality essential oil, and this is the Clove oil. So it is, we actually used to use many years ago. If someone had severe pain and we could not find the solution in the dental offices, and I don't know if you remember that, but many dentists used to use the oil of Clove to help with the pain. So it's a good idea to keep it. And again, you can soak a tiny ball of cotton with the oil, the Clove oil, and then bite onto it. Just hold it in place, and that relieves the pain. So that's pretty much all I have. I would definitely recommend that you stay on top of your dental visits and dental treatment recommendations, so we can minimize the chances of emergencies, and obviously it can happen to anyone. And as far as our office is concerned, I know some people watch this across the globe, and I know there are some of my relatives in India who watch my videos. But I can speak for our office. I'm always available. I usually tell you guys to email me because I'm checking it very frequently, and it's thurmontsmiles@gmail.com. I will answer very quickly. If you can send me a picture of your tooth, that helps me get some idea about what problem you are having, and I can guide you better. And I hope you would save this video and share it with your loved one. So in future, God forbid, I don't want anyone to go through any dental pains, but should it happen, I hope you will use this as a reference. And if you have any topics that you would like me to discuss, please feel free to email me or message below. And yeah, keep smiling, stay well, and I will see you next time.